Hello, my name is Shannon Ghizzoni, and I'm a physician assistant at the Columbus Arthritis Center. We are going to be talking today how weight reduction can affect psoriatic arthritis outcomes. So obesity and being overweight is an actual risk factor of developing psoriatic arthritis, and that includes those patients who have a history of childhood obesity. Obesity, particularly obesity involving higher levels of visceral fat, is seen in higher rates in those patients with psoriatic arthritis and psoriasis, even more so than other inflammatory conditions such as rheumatoid arthritis and spondyloarthropathies. Research has also shown that obesity can decrease the effectiveness of psoriatic arthritis treatments such as TNF inhibitors. So again, fat, particularly that visceral fat, is a pro-inflammatory substance. The presence of visceral fat can increase concentrations of circulating leptin. Leptin can lead to an upregulation of certain immune cells, including monocytes and T helper cells. That then can lead to an elevation of release of an increased amount of pro-inflammatory cytokines, including interleukin 6, interleukin 12, interleukin 17, and TNF alpha. Interestingly, the same pro-inflammatory cytokines can be seen in the disease states of psoriatic arthritis as well as obesity. As mentioned just now, interleukin 6, interleukin 17, and TNF alpha are released in both of those conditions, but so are interleukin 2 and interleukin 23. Many of these cytokines are known drivers of inflammation in the joints and enthesial points in patients with psoriatic arthritis, as well as in the skin of psoriasis patients. Another comorbidity that has been seen in elevation in psoriatic arthritis patients is metabolic syndrome. Metabolic syndrome involves a higher weight circumference along with those other metabolic irregularities. So again, how can weight reduction affect and help disease activity? Well, I just reviewed all of the ways that obesity can increase a pro-inflammatory state. There was a study in 2019 by Klingberg and colleagues that was published. It was a small study of 46 patients, 41 of them who completed the study. These patients were put on a very low-calorie diet of 640 calories per day for anywhere from 12 to 16 weeks. They were on regular psoriatic arthritis disease-modifying medications that were kept stable before 3 months of the study start and continued to be stable after 6 months of the study completion and of the treatment period. In that study, the median weight loss was 18.6% of body weight at baseline. And what was seen was that weight loss produced significant improvements in many psoriatic arthritis disease measurements, including tender swollen counts, enthesitis scores, psoriasis scores measured by body surface area. There was lower CRP levels and improved physical functioning in these patients. Those achieving minimal disease activity increased from 29% at baseline to 54% at the study completion. Also, there were improvements in disease activity that were maintained out to 24 months, even in some of those patients who regained weight. And the study did show that more weight loss was associated with more improvement in disease activity. So as we can see that there is research showing that weight reduction can help disease activity in our psoriatic arthritis patients and can actually improve in a synergistic effect with other disease-modifying medications. It can improve disease activity. Thank you for listening. If you want any more information, please feel free to visit Content Room or the WRAP ACE app, and you can also visit the WRAP website.